If you've been told that your plastic surgeon needs to specialize in just one procedure, listen to this video. This is board-certified plastic surgeon Dr. Shim Ching based in Honolulu, Hawaii. I've been doing this for about 25 years. I also practice in the Middle East, in Dubai and Doha. I've trained all over the world, including Canada, the US, Japan, Korea, Colombia, Europe. So I do feel I'm uniquely qualified to talk to you about this subject. Now, a very common question I get in clinic or when I'm meeting people for the first time is, what is your specialty in terms of what procedure do you do the most of? What do you like to specialize in? And I like to tell them, I really like to do all forms of plastic surgery. And they'll act very surprised and say, no, you have to be the boob guy or the nose guy or the butt guy or whatever. And I think it's very common, especially in larger cities, where surgeons have to specialize in one particular procedure because there's just so many surgeons around, and to distinguish themselves, they have to just focus on doing one thing. Korea, in Seoul, for example, is very specialized, and generally you will go to a surgeon that only does eyes or only does noses, and they'll all exist in one clinic. And that specialty is necessary because there's just so many surgeons around. Now, I've had the luxury of being in Hawaii, where there aren't as many surgeons, but there's still enough people that allow me to have a very thriving practice. I'm one of the busiest surgeons in the US, I've been told. And this has allowed me to have a very varied practice. I literally operate from head to toe. I do all different types of plastic surgery. Some people are doubtful that I can do everything, but I can tell you that over the years, I've really amassed enough experience doing all sorts of different things at a very high volume, so I really feel comfortable with all aspects of plastic surgery. Now, people will say, well, you can't get good at that if you do everything, and I would disagree. It's almost like telling a sculptor that you can only sculpt a nose, or you can only sculpt breasts, or you can only sculpt a finger. I mean, it's kind of ridiculous when you think about it, telling a plastic surgeon that they can only operate on one part of the body or else they won't be good at it. In fact, plastic surgery is really known for being a very varied practice of surgery, and we literally operate from head to toe. This is mostly in respect to reconstructive surgery, where plastic surgery, cosmetic surgery started. But plastic surgeons are known to operate on all parts of the body to help other surgeons reconstruct the body after trauma or cancer or any sort of disfigurement or problem where things need to be rebuilt and reconstructed and made whole again. And honestly, that is what attracted me about plastic surgery in the first place. When I first worked with my mentors in Vancouver at the University of British Columbia, I spent time with a surgeon that I greatly admired, and he became one of my mentors. And really, he was doing one thing that was so different from one day to another, and he did it so well. And I really loved that aspect of plastic surgery, and that's really why, one of the reasons at least, I wanted to become a plastic surgeon. One day we were saving somebody's foot. Next day he was doing a facelift. Next day he was doing some hand surgery. And that really appealed to me. And in essence, plastic surgery is a little bit different, especially what I do. It's a cosmetic procedure. There's a lot of artistry involved. It's not just what we call in surgery just a technical procedure. It's not something that you would do over and over again and become perfect at it just because the conditions are so similar from one case to another that repetition and doing it thousands and thousands of times is going to make you better at it. Honestly, if you don't know what looks good on somebody and you do it thousands of times, that's not going to make the surgery any better. You really have to get a sense of what would make a person look better, and it varies from individual to individual. When you take a revision case, for example, when surgery's been done and things are different, I don't think any amount of repetition is really going to help you there because you have to think on the fly. You don't know exactly what you're going to do, and the outcome is really dependent on how you feel about that certain patient and what you need to do in that certain situation, which could be completely different from all the thousands of cases that you might have done before. I think in fields such as cataract surgery, where you're taking out somebody's lens and the eyeball is more or less the same from one person to another, there's not a whole lot of variation. That kind of procedure lends itself very well to repetition. I think that's a perfect example of why you might want to go to a surgeon that does the same thing day in and day out for thousands and thousands of times over and over again. But for example, a facelift is going to be totally different. And I disagree that a surgeon that only does facelifts is the only one that's qualified and is good to do that procedure. When I do a facelift, I'm drawing on loads of experience that I gained from my training and my experience as a reconstructive plastic surgeon. For example, I used to do head and neck reconstruction, where we take out big pieces of cancer from somebody's face or neck, open everything up, and rebuild everything. In addition, I fixed facial fractures, somebody who was injured in an accident and their bones are smashed or broken in their face. Both those experiences in the past have really opened up my ability to do cosmetic surgery of the face and the neck, and I feel I can do a better job than somebody who has just been doing facelifts day in and day out over and over again without any sort of insight on the deeper workings of the face and experience on how to rebuild something from a very bad situation. So there you have it. That's some of my take on why you don't need to see a surgeon that only does one thing, and how it could be valuable that a surgeon that does many different things might bring something different to your procedure to give you the best result. I'd like to talk a little bit more about this in the second video, so stay tuned. Give us a like or comment down below if you like this content, and we'll see you next time.